All right. Good afternoon, everyone. Hello and welcome to our 8th Network of Care session. Thank you all for being here. This is wonderful. We have such a great representation from our community. Thank you for being here. And we will go ahead and get started. Hi, community. Hello, Kings County community. Welcome to our 8th Network of Care session. We are very excited about our event today. My face can already tell it. The excitement is at large. Today, we will discuss accountability as we become a well-rounded trauma-informed network of care. Please note that a raffle will be hosted at the end of the session. So therefore, we ask you to please stay with us until the very end of the session to qualify as a recipient of the raffle. Looking at the slide here with us that we have today, you might have noticed a change in our logo and name from ACEs Aware Kings Collaboration to Kings County ACEs Network of Care. The intention behind this change was purposeful and based on the goals of ACEs Aware Initiative in conjunction with the evolution of this project. I would now love to invite Julie from King's Partnership for Prevention to offer an elaborate introduction to this change. Julie.
Thank you, Linda. Can everyone hear me? Okay. Oh, man. I love it when everyone nods. Thank you so much. Thank you so much for having me. We are absolutely thrilled to be part of this incredible group. And I see so many familiar faces and new faces as well. So thank you again. My name is Julie Lafise, for those of you that I haven't had the privilege of meeting, and I serve as Executive Director for King's Partnership, now known as King's Partnership for Prevention, but we are also going through a name change. So soon that will be just King's Partnership here in Kings County, building a healthier community by bringing organizations together, which is why we have always been drawn to this project and why we initially got on board with this grant, because ACEs Aware is exactly the way to build a healthier community in Kings County. So in the beginning of this ACEs Aware grant project, the grant leaders came together and we decided on the name ACEs Aware Kings Collaboration. Why? Well, this name helped us describe the collaborative. These multi-agency initiatives were taking place, and with so many organizations on board between the grantees and the partners, and so many different trainings and initiatives taking place, it was important to brand the project itself. And ACEs Aware Kings Collaboration was a perfect fit as it showcased our common goal, making Kings County ACEs Aware. But now let's fast forward a bit. As we look into the future, we recognize the need to rebrand. Why? Because we need to showcase the who. Instead of having a name that represents the projects and initiatives, we need a name that showcases the people, the organizations, the providers, the community members. We want one name that showcases the network. And my friends, that is you. You are the Kings County ACEs Network of Care. You are the reason that we will all be able to cut ACEs in half in our generation. You are the strong, sustainable future for all ACEs Aware initiatives in our communities. You, families, patients, organizational champions, healthcare workers, and community members at large. Thank you for joining us in this effort to move upstream, supporting healthcare providers to effectively screen, treat, and heal patients with ACEs. You will already see us transitioning to this new logo, as Linda said, a Kings County ACEs Network of Care, and be on the lookout for additional information provided to you via email this week. Thank you so much for having me to explain our name transition so that we can showcase the who, and that's you. Thank you. Linda?
Thank you so much, Julie, for that wonderful introduction to this amazing change that we've been able to present to our community today. An email will also be sent over to our entire community to welcome this introduction formally and answer any questions that you might have. Please expect that email to come from Karina sometime soon this week. And before we jump into our presentation today, we would like to provide a definition of accountability as described by ACEs Aware. Shared accountability is defined as affirming a commitment to shared goals and outcomes in short-term as well as long-term, and is critical to building a successful trauma-informed network of care. Under this definition, we hope to work with our Kings County community in setting goals to establish a system of high-quality community and provider supports. Each member of the Kings County ACEs network of care has a tangible role to play in advancing this effort. The leadership and accountability structure ensures that every entity within this network is committed to rigorous referrals, documentation, responses, and follow-ups that deliver positive outcomes. Clarifying roles upfront will assist in ensuring that participating individuals and organizations understand, respond to, and affirm their accountability to the network's shared goals. By providing clarity to our partners, we ensure that an important requirement for developing and building upon partnerships with underserved communities when engaging in trauma-informed care work is to hold space as an organization or a system to hear how these communities have not been served and how that can change going forward. This recognition paired with an understanding that communities are experts in their own experiences allows for meaningful community connection and integration. Now, let's dive into it. Here are some housekeeping items to keep note of. We would like to make you aware that this session is being recorded. If you are attending remotely, please be sure that your Zoom microphone is on mute. If you have audio issues, please join by phone. Be sure to mute your phone as well. We ask that you please type your name and affiliation in the chat and use the chat for comments and questions throughout the session today. Also check your name and add your pronouns. Rename if necessary with first and last name to support our recognition of who is here with us today. Kings County ACEs Network of Care with funding from ACEs Aware is a collaboration of Kings County Department of Public Health, California Health Collaborative, Kings Partnership for Prevention, Kings United Way, Adventist Health, ARIA Health, EMT Associates, and Family Healthcare Network. We very much appreciate the work of all our partners who have committed to moving this initiative forward to improve the health and well-being of individuals, families, and the communities in which we live here in Kings County. So thank you all partners and leaders who are here with us today. Our agenda for today is as follows. We've introduced ourselves with a welcome, and we've also introduced our community leaders. We will also kick off with a Mentimeter in the next slide, and we'll discuss accountability. And we'll also have a roundtable discussion with our entire team today. And we'll also cover some service goals in addition to some actionable items to end our session for today. During our presentation today, I will request your participation for engagement using Mentimeter, among other interactive activities. If you are accessing our meeting on your computer, we recommend using your cell phone for active engagement. Please leave the screen open for continuous access to Mentimeter. If you all could please go onto menti.com and use the code 4281-1189. All partners and community attendees are encouraged to participate using the menti.com code. Right, and now I will transition over to Mentimeter. So our first question for today asks, what is one thing that brings you energy and joy? And I'm very happy to see that a lot of our members are already participating. I can see exercise, family, my kids. I am in full agreement to those three so far.
Would you state the code one more time, please, Linda?
Of course. The code is, let me provide my share. The code is shown on the screen and is 4281-1189. And as we all respond, we'll see that the responses with the largest response would be a lot larger. So we can see that a lot of things that bring people energy and joy are family. We also have puppy dogs, laughter, sleep, reading, exercise, grandchildren. Oh my gosh, this is melting my heart. Yoga, music, art, nutritious food. So we can see that family, coffee, my kids, and food is really an active response from our community here today. Working out, cooking, wonderful. Whoever put cooking, I'll be coming over for some dinner later on today. So prep yourself. This is wonderful. Thank you everyone for your active participation. I will now close the voting for this Mentimeter. But please note that we will be utilizing this Mentimeter for additional questionnaires. So please leave it open, whether it is on your desktop or on your cell phone. You can all bear with me. I'll just navigate over back to my slides. Hey. And now I will pass this over to Stacy Hudson, who is our new community engagement coordinator, to carry out the rest of this presentation for us.
Hello, everyone. I'm Stacy. Just like Linda said, I am the new community engagement coordinator for California Health Collaborative's ACEs Aware project. I'm super excited to be here. I am really hoping to share with you guys today this message of hope. ACEs are preventable. They are treatable. Science shows that when these 5 protective and preventive factors are established and promoted across systems and organizations within communities, children and families can thrive. While you review these 5 factors, we'd really like you to consider which organizations in your community act to strengthen household financial security. Who are the leaders that are in a position to engage the community and affect legislature and policy changes? Which organizations are involved in quality improvement within the early child care and education field? What organizations in your community provide parenting support and education regarding child development? And what disciplines are currently engaged in this work, be it behavioral health, social services, primary care? And do you see any gaps in intervention services within your community? It's a lot to think about. All of these individuals and organizations are necessary for building that message of hope, and that also includes you. How do we call to action within our network processes to establish these supports in our community? During this session, we hope to offer knowledge on ways we can develop supporting policies and acts of service toward this message of hope. Next slide, please.
All right, I would love to share this video with you all. The concepts of this clip provides a compelling message on the impact of ACEs and how it can be prevented. Due to the prevalence of ACEs, we recognize that this content can hit pretty close to the chest for some of you here today with us. We encourage you to show yourselves compassion. Remember that ACEs is not destiny, and understand that facing ACEs in your own life or the lives of those who you care for takes courage. This video is 4 minutes and 36 seconds long. I ask that you please take down some notes as you watch it in preparation for our discussion on the thoughts and feelings this video inspired.
My parents don't understand. All the drinking and fighting means I'm scared. I'd like a cuddle, perhaps a bedtime story, but mostly I'd like them to stop shouting at me, and sometimes they hit me. Feeling scared every day and not feeling loved or wanted will change me for the rest of my life. Later, I'll have problems with school, problems with alcohol, and I'll get in trouble with the police. What's happening to me right now means I'm more likely to have serious health problems in middle age and die sooner than I should. Doctors say my life is full of adverse childhood experiences. both aces. But in my world, this means I see my dad hitting my mum. Dad's got a drinking problem, and Mum's always crying, even with the tablets. I'm always being shouted at and hit. After the booze and fags, there's not a lot of money for toys or clothes, or even food. I'm getting used to being scared all the time, but now I'm just angry. Doctors say things are changing inside me. My brain isn't learning how to control my feelings properly. My body can't relax like those kids who don't have aces, so my body won't be able to repair itself properly when I get older, making it more likely I'll get cancer or heart disease as an adult. It hurts when my parents hit me, but the real damage is hidden, and that damage will be with me for life.
I drink and smoke. They say I'm out of control, but I'm not. It's just my way of coping with my aces. I've been in plenty of fights, but what's wrong with that? Kids' punches done it half as much as when my dad hits me. I beat up a kid last week at school because he looked at me weird. Who cares? I ended up with more time out of school. Learning's not for me anyway, and the teachers don't care any more than my parents. I don't like the way anyone looks at me except my girl. She's 16 and pregnant, just like my mum was with me.
So this is where I've ended up. I've got diabetes and cancer is probably on the way. I know these kill you, but I couldn't do without them. I've never had a proper job and I've spent time inside. I hit my kids. I hit their mum too, until she left. So my kids have grown up with aces. And now my daughter had her first kid. She's 16. The course of my life was set in the wrong direction a long time ago. I know where I'm heading, and sadly I know where my kids are heading too. This doesn't have to happen. A little help in childhood makes a big difference to where life takes you. When I was a baby, the nurses noticed that my mum wasn't coping and helped her and explained how important my childhood is to the rest of my life. So, with a bit of help, she coped. The police came round after next door complained about the noise from Mum and Dad fighting. They asked how I was feeling. I told them I was scared all the time. Mum and Dad got help, the shouting got better and the hitting stopped. I even got some bedtime stories. I still had problems at school, but the teacher asked me about what was happening at home. I got help controlling my feelings. It wasn't a lot, but it was enough. I'm now married with 2 children and I've got a job. Most of the time. I haven't repeated the same problems with my kids. We got help when being a parent got too much. Our children are ace-free, and that means their kids stand a good chance of growing up ace-free as well. Almost half the people in England and Wales.
All right, thank you so much everyone for paying great attention to that video. I will now transfer over to the slide deck for today. The ACEs Aware Initiative is focused in our state's healthcare system on healing the negative impacts of ACEs and toxic stress. This video shows us one person's story of how ACEs affected their life. It calls out ACEs categories such as abuse, neglect, and household challenges that lead to high-risk behaviors such as drinking, smoking, and how they may lead to diabetes, cancer, heart disease, and early death. The intergenerational transmission of ACEs is further discussed as we see how putting a stop to such transmissions is supported by community efforts in servicing parents, children, and families. The video further brings to our attention to the need for community-wide education and action in preventing ACEs by identifying existing buffering supports and making them more accessible to children, family, and adults. This video calls attention to our need to shift our thinking from what is wrong with you, such as what is wrong with that child? How could that mother stand by while the husband beats the child? Why is that child acting like a baby? Why can't he act his age? How could someone abuse a child? All of those remarks that I just mentioned focus on blame and judgment. We want to change our perception to what happened to you. With this change, we recognize the power of the past in shaping our current functioning, and it helps us know how good or bad experiences shape us. Looking at what is behind the behavior, the brain allows us to feel, think, and act. Something happened that influenced the way their brain works. The character in this video points out his anger in response to his trauma. Now, I would love us to discuss. Navigating back to your Mentimeter, please share with us, how did this video make you feel? And if you could please share with us how this video made you feel. We have one response that says, sad. The video made me feel sad. Another person said, very sad. Hopeful. Love that. And that is the message of hope we're hoping to share today. Negative. It really hits home. Motivated. Sympathize. Motivated hits again. I'm happy to see that a lot of our community today are feeling motivated and hopeful. It brought sadness. It's so prevalent. Opportunity to do more. Sad that people will suffer from the past. There's work to do. Awakened. Thank you so much for sharing your responses today. If you would like to unmute yourself, please feel free to also share how this made you feel. So now I would like us all to think back to the boy's story. Compare the two versions of his life. First, no one intervened and his life took a downward turn, physically, socially, and emotionally. In the version where the nurses noticed the mother struggling and took action, law enforcement took a trauma-informed approach, as did his teachers as well. His life outcome was dramatically different. This is why screening is so important. When we screen children for family and adversities early in life, that increases the likelihood of early detection and early intervention. This should include creating rapid response and referral systems that can quickly bring protective resources to bear when early life adversities are detected through the coordination of cross-sector expertise, which makes our Kings County ACEs network of care that we are representing here today. When screening for adults, that allows for improved treatment of ACE-associated health conditions, and it also offers opportunity to prevent vertical transmission of ACEs and toxic stress. Primary care providers can develop longitudinal relationships with patients, providing multiple opportunities to screen and to build the level of trust necessary to discuss ACEs. Safety, social service, community, and faith-based organizations that respond with a trauma-informed lens have an opportunity to also form relationships with individuals and families that can mitigate and even prevent the impact of ACEs and toxic stress. Viewing healthcare providers and community organizations are necessary partners within this trauma-informed network of care is likely to enhance and sustain efforts to address the needs of individuals who are at risk for toxic stress. Conversations about each of our roles and responsibilities will help form a cohesive trauma-informed network of care. Now, we wish to conduct an anonymous participant screening where each participant within this session will provide their ACE and resilience scores. We ask that you please take 5 minutes to complete the screening and questionnaire using the document that will be uploaded in the chat by our team member, Stacy. Following your review, utilize our Mentimeter to provide an anonymous response to the following. We'll be asking within Mentimeter, what is your ACE score? What is your resilience score as a child? And what is your resilience score now? We will be uploading the document to support the response for this questionnaire. Stacy. And afterwards, we'll also be discussing it as well. And please know that the response to this questionnaire request is completely voluntary and also anonymous to your response. Just the technical issues in identifying their document. If anyone would like to unmute themselves with any comments to the session so far, please feel free to.
I thought the video was powerful. I thought I was the person who said there's a lot of work to do because it presupposes that the children at each of the ages represented in the video, the teenager and the younger kiddo, would have the ability to articulate what they're experiencing and what they're feeling versus seeing that what happens in my household is just normal and assuming that this must be happening everywhere else, which is generally the case, that kids think that this is just the way it is, unless they are presented with information that everybody doesn't live this way, right? So they tend to normalize their experiences, whatever those are, and that's also a coping mechanism. So I watched going, okay, there's work to do on so many levels, being able to give kids that language and that awareness of their experiences and permission. Permission is big for me. Permission, giving kids permission to be, giving kids permission to express and to do so without judgment, and to learn to not even judge themselves for how they're feeling. So thank you for the video.
Thank you so much, Melissa, for keying in on that very important message and experience with watching that video with us. Truly appreciate your response on that. Thank you so much, everyone, for your very guided patience as we identified the document. Just so many screens working with and a shared file, so I really apologize for that delay. But the screener and resiliency screener has now been uploaded in our chat. We would like to give you all 5 minutes to complete the screener, and we will reconnect at 2:41 to discuss the outcome of the screener that you've completed. Thank you. Now I will share my screen to ensure that we're actively viewing the responses from our community today on their ACE scores. And please note that this is a voluntary contribution. You are not required to actively participate in presenting your score or reviewing the screener and resiliency plan. And I can see our entries are coming in. We have 13 participants so far. And we have 62% of our community so far, 64% now have an ACE score of 4+. And for an ACE score of 1, we have 7% of our participation today. We have 6% folks here that are ACE score of 2, 11 at an ACE score of 3. And for an ACE score of 0, we have about 21%. The ACE score of 4 or more is decreasing to a 55%, but we can still see that over half of our participants today are showing an ACE score of 4 or more. Okay, and now we are now seeing a total ACE score of 54% for being a score of 4 or more. That is over half of our representation today have an ACE score of 4 or more. We can also see that 0 for ACE score of 0, we have 17%. For an ACE score of 1, we have 4% of our population today. ACE score of 2, we have 17%. And an ACE score of 3, we have 8%. Thank you so much, everyone, for your participation. It is greatly appreciated. And now our ACE score of 4+ has increased to 56% with an additional response. Thank you so much, everyone, for your participation. We understand that screening is most appropriate in primary care settings, and the results from this task may have been truly traumatizing for some. We hope that this request empowers our network to know your own personal history of ACEs. If we want to change individuals, organizations, communities, and systems, we need to talk about our ACEs and how they intertwine throughout our lives. This means at the individual level, learning about your ACE score and resilience helps us understand why we behave the way we do, and that our coping behavior is normal, a normal response to abnormal circumstances. At an organizational level, staff and leaders can also use the knowledge of their ACEs and toxic stress mitigation to create healing-centered work environments and programs in all sectors. At the community level, educating the public about ACEs and resilience can provide hope and foster development of innovative ideas about how to support families, organizations, and communities. Understanding the interplay within positive and adverse experiences offers opportunities for engagement with all sectors. At the system level, policymakers and leaders can use research about ACEs to find common ground across fields and to support policies that promote the understanding of ACEs and how adversity and positive experiences can work together. Looking at the scores of the participants present today, many of us are impacted by ACEs, either through personal experience or the experiences of those that we love. Understanding your own ACE score helps you to connect with compassion and respond with respect to meet the needs of your community. When we consider the resiliency factors in our lives, we realize our strengths and understand that there is hope. Utilizing that lens of resilience when we connect with individuals, children, and families helps us to shift the focus from what has happened to you to what strengths do you bring to bear in the face of adversity. And now we will transform over to the next question on our Mentimeter that seeks to know your resiliency score. So if you could all please navigate over to your Mentimeter, the next question asks, what was your resilience score as a child? So here we have a resilience score of 14, some are stating 13. We're having a higher percentage with 10, 13, and 14. Now just wait for those to populate. We've had an average response of about 22 to 24 participants. So far we have 12 responses and we are seeing a resiliency score of 9 reported at 8%, resiliency score of 10 at 17%, a resiliency score of 12 at 8%, and another at 14 at 31%. And now we're seeing a response from a resiliency score of 2 at 7%. And so far, our leading responses on the resiliency score as a child is at 29%. All right, I will now move over to our next question. This question seeks to know what was your resiliency score as a child? And now we'll shift over to what's your resiliency score now as an adult? So if you all could please key in your responses to what is your resiliency score now? Okay, we have a resiliency increase at 14, at 67% so far. I will wait till I have about 14 or more responses, and then we can navigate to the rest of the session for today. We are still seeing a leading score for 14. Thank you so much, everyone, for your responses to this screener question. We really appreciate your participation, and we understand that these responses are not easy to take in. And we also show compassion towards that. And now I will turn over the rest of the presentation, the slide over to Stacy to please take us into the introduction for our next activity for today. Stacy.
Thank you, Linda. And thank you everyone who was able to participate in that activity. And like Linda said, we know it can be difficult to answer those kinds of questions for yourself. But we just wanted to reinforce that ACEs is not destiny. And that even if we might have not had very high resiliency factors as children, we can bolster that as adults and protect our children moving forward. Now that we have had a chance to discuss the need for this work and develop an understanding of the ACE and resilience scores of those who are here with us today, let's dive into how to connect organizational services to provide buffering supports. The Stress Busters wheel that you're looking at right now, as put out by Dr. Nadine Burke-Harris and ACEs Aware, identifies 7 elements that mitigate toxic stress. That's mental health services and supports, access to nature, mindfulness or spiritual practices, physical activity, balanced nutrition, quality sleep, and supportive relationships. And I think back to that first question we asked you guys at Mentimeter, a lot of those things were mentioned in this list in our very first question, which is really pretty cool. Because we now know that development and epigenetic changes are driven by life experiences, both positive and negative, and that buffering supports and targeted treatments can reduce, reverse, or even prevent negative health and social behavioral outcomes resulting from childhood adversity, we are driven to identify the existing toxic stress specific buffering interventions that are already underway here in Kings County. It is important that we understand how our individual health centers and community and faith-based and social service organizations provide buffering supports and create goals to push our programming efforts forward. What will make this work most effective is if we come together as a body of multidisciplinary and multicultural entities, recognizing our individual strengths, ties to the community, and connecting each of our unique services and supports across our many organizations. Linda, would you be able to share the Jamboard links? We're going to be doing an activity here today where we're going to ask you to connect and think about what your organizations provide as far as services are concerned to your community and how those services fit into the Stress Buster wheel.
And Stacy, we'll be including the links. Hi community, we'll be including these links within the breakout rooms. We'll now be breaking out into 2 rooms. We have about 40 folks in attendance with us here today. So we'll be breaking out into 2 rooms. That will allow for 20 participants per room. And within these rooms, we'll be discussing this, the Stress Buster wheel, and we'll be allowing, providing support to each organization to integrate your services into these wheels. So if you could give me 1 second, I will be creating these rooms, and feel free to jump into the rooms as you are all assigned. And thank you so much for participating in that Jamboard session. And I'll be sharing my screen to just quickly share the results from this activity that we conducted today. I know we're short on time, and we have quite a few to cover, and I hope that we can get through it for the rest of the session. We had a lot of technical difficulties today, and I truly apologize for that. But to discuss the results from the Jamboard session where we integrated our services into the Stress Buster wheel. Under room 1, we can see here that services were integrated within mental health, healthcare support, supportive relationships. We also had a large response from our balanced nutrition section. And we'll be reaching out to each of you folks to connect with you to understand your services more, and also see how you can integrate the services beyond this activity, but also integrating it within our referral exchange to support providers as they screen for ACEs and refer patients out to the community to provide support in mitigating shocks of stress, or providing services for social services. And also, as you completed this, we'll also like you to think about other organizations in your community that could also contribute to the Stress Busters wheel that might not be a member of our network. How can we get them in to ensure that they're also documenting their services as well? Within our room 2, we also had quite a large response as well under the balanced nutrition section, mental health, meditation as well. And this is wonderful. I love to see this. I would also like you to think, how likely are you to invite those organizations who are unable to participate with us today to continue their participation to be a part of this? And we also encourage you to continue to fill out your services within this wheel, even after this session, if the time allows for you. And now I would like to turn it over to Karina to provide an introduction to the resources that have been developed to support the continuity of this project.
Perfect. Thank you, Linda. I'm actually going to share my screen so that I can show you. So if you haven't gone to our ACEs website, please do that. You can either do kingsaceswear.org, or under what we're doing, you can go to our ACEs, and then it's all here. So, oops, sorry. So what I want to show you is something we've been working on. It's really, really exciting. We created a toolkit, and I want to kind of just go through it a little bit with you just so you can see it. But I highly suggest that during your own time to really go through this, because there's so much there's so many resources and so much material in this document that we really want you to utilize. So just letting you know, you can access it through our website right here. Takes you to it. You can download it here. This is the PDF. All right, so the reason that we made this, first of all, is instead of just giving you guys a toolkit of general ACEs information that you've seen in every training and every PowerPoint, we wanted to actually do something that's going to help this network of care be sustainable. And what that means is that we want to give you actionable steps that helps this network of care really become strong, and that we're all on the same page, that we're all connected. So that is what this toolkit is for. It's for you, it's for the community. So some of the information that's in it, you can read how we said about our new logo change and everything. You can read about that here. You can read about what is in our toolkit and why we have our toolkit, why we want you to have the toolkit. We have all of our social media, our website, our PACES connection. All of these links are linkable. You can click on them and follow us. We have some generic information on ACEs. And then we start getting into kind of what we just did right now. So the toxic stress regulation, we kind of, provide some things about what these look like, balanced nutrition, trying to eat fresh whole foods, physical activity, getting at least 30 minutes of exercise every day. So we talk about how important this is throughout this toolkit. Exactly what you just did right now is outlined in this toolkit, because that's what we want all of our network of care members to actually complete, so that we know who is in our network of care and how strong we are. So some of the other things we have in here is our get involved section. So our get involved section is pretty explanatory. It's how you can get involved. So we have our engagement events, which is our network of care session, but then also our peer-to-peer section. And I'm not sure if you can see the bottom of this. There we go. Then we also have our supplemental trainings. So if you haven't signed up for one of those, please do so. And all of these clicks are linkable. So you can always just come here, click and register. There's all this information on it. And then our referral exchange that we've discussed, we have some information about our referral exchange, how you can get some more information, how you can sign up for it. It's all here. We have some more information about Unite Us and Kings County Referral Exchange, a little more specifically, what it is, why you should join, and then some of those details, like what is the cost? And then down here, how you can actually learn more and start participating into this. Another get involved is our PACES connection website. So if you do not know what this is or haven't signed up for it, please utilize this page for all that information. It explains what is PACES connection, why you should join, and then how to join, because there is a generic PACES connection website, and then Kings County actually has our own little website that if you sign up, you'll get notifications, you can see our meeting recordings, all that good stuff. We also have the Becoming ACEs Aware. This is that core training that ACEs Aware provides. And so we wanted to definitely get that to you guys. If you have not taken that training, we have it right here. So you can click there, take that training. And then to self-attest, that's, for example, like if you are a Medi-Cal provider and you want that reimbursement, you do self-attest onto the website so that you can get that reimbursement. But there's also a self-attestation where it then puts you into a provider directory. So you can actually go to that page and put in your location, and it shows a map of exactly who it is in your community who has taken this training and self-attested. So you can check that out here. If you're confused about all these different parts of this ACEs program and this whole process, because there's a lot of parts, so this breaks it down into the steps. And so where we are wanting us to, move forward, we're helping with the trainings and the screenings and the, but we want to definitely get everybody to be on the same page with our resources. And that's where we are implementing the Kings County Referral Exchange. And so that's kind of like in our step 4, and then step 5 is continuing. So this is what we meant by sustainability. Step 1, step 2, and step 3 is what you always hear about, but what we want to do, sustainability, is that step 4 and that step 5. So I'm actually going to let Linda speak on this page really quick, just a general information. It's going to be about this network of care membership. So Linda.
Yes, thank you so much, Karina. So as Karina has mentioned, this toolkit provides resources from everything we've discussed in terms of action for our community to push this work forward. And a huge part of that is our network of care membership. We presented this network of care membership during our very last session, where we provided a link, which I'm happy to re-provide again today, for our community to please provide a response to this network of care membership in order to be a part of our network. This will allow us to better track who is part of our Kings County ACEs network of care, and give completion of this network of care with 8-hour responses and creating a resiliency tracker for our community to see who is integrated in this work. It's a very simple form. It does not require any full commitment. It's just a completion of a form that allows you to integrate officially into our network of care. And we hope that you all could please take the initiative to complete this form and provide that response for us. And I will be linking in that form. Cameron, were you able to support me with that? Okay, oh, Cameron posted the access to the toolkit, but I will also be linking the network of care form. But please note that the network of care form is also available in the toolkit when you click on this page. Thank you, Karina.
Perfect, thank you. Okay, so this page right here, this is to help you guys see where you fit in. So this is actually was provided by ACEs Aware. It kind of shows what kind of organizations can be seen in a network of care. So if you think, I don't know where I fit in, this is where you fit in. So it breaks it down between all the different sectors and which organizations actually should be a part of it, not just can be a part of it, but actually are encouraged to be part of it, because all of these organizations, teams, clinics on this page have the ability in some way to prevent, treat, and heal toxic stress. So if you don't know where you lie in that, please look at this page so you can see exactly where you fit in. And if you want any more information, also on the bottom of all these are citations, so it'll lead you directly to the document where we got this, and it actually explains even more in depth what those organizations actually look like. Here is actually a tracker of the Kings County organizations that we currently have participating. So that's you. So this is kind of encouraging to see, because it shows how many of each of these we actually have. And we definitely want this to be 12 or more on every single one of these lines, but you can see that we have gotten a good start, and we're just at the beginning. So this is where we kind of can gauge where our gaps are. You can see where we have less. So that's when we are promoting to the community, that's the ones that we're gonna, focus on, because we want everybody to be included. So this is really, really excited, and I'm excited to share this with you. So we want you to get involved. And one of the ways that we decided that to promote your involvement is through a incentivized community action step system. So we have 3 tiers at the moment. We have a bronze, a silver, and a gold. And your teams and organizations can complete these tasks. And after those tasks are completed, you can then receive these awards. So for example, for bronze, that network of care membership form that Linda was speaking of, and then you can see several team members have completed the ACEs core training. Once that is completed, you can get a website shout out from us. So we actually have specific Instagram and Facebook images that will give a shout out, will tag you, will help you promote. And then we also have a decal that we will be giving you, and so that you can have it on your organization or your clinic or whatever that is, so that you promote to the community that you are involved with this project. And so hopefully the community starts identifying that and seeing, oh, hey, this person or this organization is involved, and that makes them encouraged, because they know that that means that you care about them. So there's a lot of great things in this. There's a lot of great prizes. And so we really, really, really hope that you will look through this and feel motivated to participate on this page. There's a lot on it. And so if you actually go to the page where the toolkit was, and I'll show that really quick, on the bottom, it actually explains it even more in depth. So you can go through these again, and it has a little bit more information if you are, if you do have questions, such as who you send it to and deadlines. So we have this one, and then we also have this other opportunity to win a $25 gift card. This is separate than that commitment to care incentivized steps, but this is also another opportunity. So the first one is, let's say everybody in the organization completes the core training, they're able to raffle off a few gift cards. And then this one is completing a ABC worksheet. There's also gift card opportunities. And if you were not able to actually accept a gift card, maybe because of a work policy or anything like that, we do a pay it forward. So you can actually say that you want this $25 gift card to go to a certain donation, like a organization or a nonprofit or a charity of your choice. So then here we have a readiness assessment clinical model, and then we also have milestones for community. So what this is this readiness assessment is going to be more provider focused. So it's going to be for more medical providers. This milestone one is going to be for service providers. What these documents act as is kind of like actionable steps that you can do in your own organizations to kind of be a stronger network of care member. And so there's, like you see, there's different milestones, there's different ways that you can do that. So please look through that. If you have any questions of how to make your organization more trauma informed. And then the ABCs is a worksheet that we created. So this helps you do exactly what you just did in that breakout room. It helps you assess your services, break them down, and connect them to the wheel. So you can use this to remember, and you can use this image so that you can see where your services go in, and then there's a case study. So if you're still confused, we have a case study. So our case study is based off of 211, and then we show exactly where 211 put their things and how they did it. It explains it right here. So all that information is there. Lastly, we just have some basic screening tools, documents, all that good stuff. So our last pages are kind of all, the actual questionnaire itself. We have the pearls, which is the pediatric version. So we have all that there for you too. And then at the very, very end, just the really important websites, links, forms, and documents, and all of our references. So as you see, it's a lot of information, and I really, 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 really encourage you to look at it because we worked really, really hard on it. So thank you.
Thank you so much, Karina. And I will go back to sharing my screen here. And I do want to call out to the fact that we are against time, but we do have some very essential information to cover for the rest of our session. And we'll try to go by it really fast. But as you know, if you stick to us with to the very end, there are raffle opportunities for your organization to participate in. And Stacy, I will take this over to you.
Thank you, Linda. And thank you, Karina, for sharing that. A lot of hard work went into that toolkit. We really appreciate you presenting that today. It is our goal to promote and support every organization's ongoing success and implementation of ACEs screenings and/or trauma-informed care practices. We value the approach to invest in organizations by providing resources for guidance and providing incentivized support, as Karina had discussed, to those organizations that are already doing this work and those that need support in initiating a trauma-informed workplace. Therefore, we would like to offer additional support and guidance by seeking to know if your organization is in need of educational materials to support leadership and staff understanding of ACEs and trauma-informed care, if you are currently implementing trauma-informed practices or you're in need of support and resources to adopt such practices, please complete our funding and support survey. I believe Linda's going to be sharing a link to that in the chat. Your responses will enable us to learn more details about your organization's services and clientele to ensure that all the resources and materials we provide are tailored to your needs. We also would like to ask that you provide feedback to aid in our efforts to improve resources and materials as needed. So if what we share with you maybe doesn't quite exactly target your needs, you can always let us know and we will work to improve on it. If you are an administrator or a leader in your organization, consider those organizations that you already collaborate with that serve to meet the needs of your community. What can you do to support their path towards becoming ACEs aware and trauma informed? Consider inviting them to participate in the network of care. If you are not an administrator, what can you do to inspire your organization's administration to connect with and support outside organizations? Think about those individuals in your community that might participate as speakers to those organizations on self-care practices, ACEs and toxic stress, and trauma-informed care practices. How can they get involved? We would like to introduce you guys now to our partners at Kings United Way, who are here to provide details about tools and resources that can help you connect your clients with resources in your community.
Nanette, you're on mute. There you go.
Thank you, Stacy. Good afternoon. My name is Nanette Villarreal. I'm the Executive Director of Kings United Way. It is my pleasure to be here today with Lexi and Erica to share information with you about tools and resources that we believe will be a benefit to your organization.
Good afternoon, everybody. My name is Erica Lopez. I am the 211 coordinator at Kings United Way.
Hello, everyone. My name is Lexi Terrell. I am the Community Engagement Manager for Kings United Way. Nanette's going to talk about some best practices for accountability.
Thank you, Lex. The Becoming ACEs Aware in California training is a free 2-hour training to learn about adverse childhood experiences, toxic stress, and the impact of these on our long-term health. Although this training has been introduced primarily for the clinical setting, our team at Kings United Way quickly determined at the conclusion of our training that ACEs and toxic stress can exist within people from all walks of life, including our neighbors, family, friends, coworkers, and yes, our clients. The Becoming ACEs Aware in California certification training is not a tool to help them, but rather a tool to support us, you, me, and all the people impacted by ACEs. Becoming a trauma-informed workplace requires commitment at the highest levels of leadership. We must be willing to establish procedures for mandatory training and be willing to support our team members in investing the time necessary to become trauma-informed. That commitment does not stop at leadership. Governing boards play a vital role in establishing policies within organizations that affirm a commitment to being trauma-informed. If you are a leader in a leadership position within your organization, I am asking you to take time to review the training link provided. If you are not in a leadership position within your organization, please share this information with your supervisor and encourage them to reach out to one of our ACEs partners for further information. Shifting gears slightly, I would like to introduce our 211 coordinator, Erica Lopez. Before I do, I want to publicly thank her and her team for the long hours and unwavering commitment during the pandemic to keep community resources in the 211 database current and accurate. Calls during this period increased by over 400%. In 1 month, she and her team updated over 350 programs in the 211 database. Because the Kings County database information is available in both English and Spanish, this workload was doubled. Please join me in welcoming Erica Lopez.
Thank you, Nanette. So offering our community with updated resource information is extremely important to us. With the help of our community partners, my team and I are able to keep resources updated in our database. In Kings County, you can access 211 5 different ways. Dialing 211 links callers to a call specialist who direct them to resources such as food, shelter, employment, healthcare, and more. Resource information can be given over the phone or texted to caller. If the caller agrees to a follow-up during the time of the call, my 211 Kings County team follows up with the caller to see if the caller was able to connect with those agencies and also provide additional resources if needed. Clients can also text their zip code to 898-211 to receive information on resources. Live chat is also available on our website, 211kingscounty.org. Lastly, users can search our database by downloading our mobile app 211 and telephone, which is available in both English and in Spanish. Next slide, please. So ACEs Aware recommends connecting patients to the network of care to support the treatment of toxic stress through the evidence-based interventions for mitigating toxic stress. 211 is an easy, important resource for the Kings County ACEs network of care for responding to ACE screenings and mitigating toxic stress, connecting patients to both social services and resources that address toxic stress, like resources that help with physical activity and mental health. They can also be connected to resources to support social needs, such as housing, utilities, transportation, household resources, and more. Our goal is to create a page on our 211 Kings County website to help providers, patients, community members to easily access this information. So now that you know where your organization fits into the Stress Buster wheel, we will use the gathered information to make this page on the 211 Kings County website. Please join us in getting not only your organization resources on this page, but also all the organizations in Kings County. As we all continue to learn about ACEs and how we can support each other, talking about the Stress Buster wheel and getting the right information on what organizations offer can make a huge difference for our community members. At this time, I would like to turn it over to Lexi to talk to you all about the Kings County Referral Exchange and how you can join. Thank you.
Thank you, Erica. As you've heard today from Linda and Karina, and even Stacy talking about the Kings County Referral Exchange. If you haven't heard about it yet, I'm going to talk a little bit more about it. So first of all, I just have to say that 211 will remain a valuable resource. But now we need something that fosters true connection and is a referral management system. So the Kings County Referral Exchange will supplement the efforts of 211 by becoming a database for providers that enables you to send referrals to other organizations on the platform for your client to get connected to appropriate resources that help reduce toxic stress and also address any other needs that the client has. Built-in screeners like the ACEs screener and the ability to download reports make the RE a versatile tool to support our organizations and our community. Now let's take a look at what a client profile will look like on the Unitas platform. Next slide, please. So as you can see, Eric is a 40-year-old single male that is looking for health insurance to get services to address his health needs. Since he lost his job, he needs to get benefits to get some mental health services to manage his stress and other health concerns. So the first referral being sent out for him is to get into an organization that helps benefits eligibility. All the services are geotagged to be able to get the client to a resource that is close to them and shouldn't require special transportation. Once the referral is sent out, that organization gets an email notification that a referral is waiting. Then they can go in and accept the referral and get Eric to services much faster than someone having to call all the service options. The client can choose to get email and text notifications when referrals are accepted so no one falls through the cracks of care and everyone in his care team stays up to date. Next slide, please. To get Eric and other community members the services that they need, we need all organizations that serve Kings County on the Unitas platform. The connections made on this platform will create the Kings County Referral Exchange, but also expand to the Unite California network for community members that move beyond our care. Here are some upcoming sessions for you to learn more about the Unitas technology platform. Information sessions will cover how it can be used and how your organization can join. If these times and dates don't work for you, please reach out to myself or Kendra Division from Unitas to schedule a session that works best for you and your organization. I will be providing the contact information and the links to the 211 website and the Kings County Referral Exchange information in the chat now. Thank you. And back to you, Linda.
Thank you so much, Erica, Nanette, and Lexi for that very informative information. Thank you so much. And now we're approaching the very end of our session. And we really appreciate you all for hanging in there with us. We know we appreciate you for being here, especially because we are out of our minutes for today. Now I have attended. What now? What's next? I know that's a lot of questions in a lot of people's minds, and I really appreciate the private messages that I've received in the chat so far from organizations who are currently doing this work. and those who want to join into this work and who are seeking for ways to be a part of it. We really appreciate those, and please, we'd like to let you know that you are free to contact us on email and schedule a private Zoom session with us if you would like to learn more about our services and how your services integrate into this work. So the what now, what's next question is a question that we plan to ask at the end of each session to ensure we are presenting the right information and engaging local and regional leadership and offering action items that will bring leading partners into this work. We would like to request your help, the help of the organizations in our community and clinical representatives in this call to help us with communicating the urgency of this movement to your organization's administration, just as Nanette had mentioned. The only way we can move towards strengthening this network is if administrators understanding the implications of ACEs and the importance of trauma-informed care practices. If you are an administrator, you can be a champion for this movement to help your organization move forward in becoming a part of the network of care to cut ACEs in half in this generation. So as we provided before, please complete our membership form. We would like to encourage a membership composition that includes the key identified stakeholders covered within our toolkit and within the session today. We would also like to ask that you please utilize this wonderful toolkit that our team has diligently worked on the past months. So please use it to complete the steps to become ACEs aware and trauma informed. Join our referral platform. Lexi, Erica, and Nanette provided elaborate information on how to be included in this platform. We ask that you please reach out to their team members to request more information about how your services that you've entered in the will within the activity today can be integrated within that within the referral platform. I will also ask you to please complete the community needs form. This allows us to provide support to you. I've had some organizations reach out to me in the chat. They're very, very happy to extend their free services to provide support to organizations who wish to be trauma informed. And as you digest this information, those services will also help lead you to a place of resilience. And lastly, for providers, we're asking that you please screen, refer, and network with us. And that concludes our session for today. But before we exit, we would like to hear from you. But prior to getting to the hear from you, I would like to fast forward us over to the survey. We have developed a survey for your completion for our session today. If you could please enter the collaborators for today's session to be Kings County ACEs Network of Care, that would be wonderful. Our team will be including the survey link. George, if you could please support me, including the survey link into the chat for your completion. It's very highly important that we receive a response for our survey. Your response to this survey will allow us to strengthen our session and to see what value it adds to your programming efforts. So thank you so much, everyone, for being here today. We truly appreciate connecting with you. And for those that are left in the room, if you are open to it, we would like to hear from you regarding your work on ACEs and to learn how we can further support you. And now we'll leave this room open. I will mute myself to the community to please provide a response.
Hi, I'm Melissa with The Art of Anger, and I would love to support all of you in the amazing work that you're doing with families. And I believe that it's important that we support both the folks who we're identifying as dealing with trauma in the present as the children and families that we're dealing with, as well as I think all of you as staff, as clinicians, as support staff, everyone who is engaging with these children and families are at risk for secondary trauma as your ACEs are triggered as well. And so part of what I do is provide services for folks dealing with and releasing that trauma. And oftentimes I have folks, the therapists that refer people, many of them also come because they recognize that they are being triggered for dealing with their own issues that are coming up for them as they are needing to heal those. So that's one of the ways that I want to support all of you is making sure that the folks providing the care can get support for their own ongoing healing journeys.
Thank you so much, Melissa. Melissa's business is hosted in Fresno, and we're happy to provide additional information if anyone is open to learn more about the Art of Anger. And we encourage you, Melissa, to please pop in your link so our community can have access to the services that you provide towards this initiative.
I suppose I probably should have said what we do. Sorry. It's a trauma transformation center. It's a actual place of releasing. Colloquially, people think of it as a rage room, but we're far more than a rage room, and it's designed quite differently. It's a very unique model. You make art out of you can choose to make art or a stepping stone out of the shards from your destruction, but we do have full-on rage rooms, though we're the only rage room on the planet that does not have an age minimum. So it's my discretion and that of the parents as to what we do with the children when they come in. So my sidewalls are padded, and it's really designed for families to be able to come in.
Thank you, Melissa.
Thanks.
And if there are any other community members who would like to share the services that they provide towards this effort, please feel free to mute yourself. If not, we can end the session.
Could I add something? I'm not technically in your community. I'm in Phoenix, but I just wanted to share a thought. First off, I feel very honored to have won today's raffle because I don't ever win, so I'm really excited. But when we were doing our breakout session, the idea of access to nature came up, and here in Phoenix, I work with SNAP Ed, so work with community nutrition. One way we promote access to nature is through gardening. So we understand that people don't always have access to parks or, whether it be national or local or state for that matter, but just bringing nature to the home, whether that be like an indoor garden or just an indoor plant or like a backyard garden, sensory or vegetable. Also through like just the idea, sense, like the smell of different nature, the sounds of nature, like listening to it. So just trying to think of creative solutions for those that might not be able to have that like typical park access. Just wanted to throw that in there.
I really appreciate that, Christy. And that's something that I do personally. I garden a lot. And the idea of also spreading that joy of gardening as a factor of resilience is really wonderful. I really appreciate your input in this session today.
Sure.
Thank you so much for being here all the way from Phoenix.
Yeah.
All right. Without further ado, we will go ahead and end this session. Thank you so much, everyone, for being present today. As you know, this session is hosted monthly. And George has also included a survey link on in the chat. We'll also be sending out an email with a reminder with this survey link in case you missed it. But we hope to see you at our next session that will be held next month. And we'll be discussing trauma-informed practices within this session. And we hope that you also add value with your attendance. Thank you very much, everyone, and have a wonderful rest of your afternoon.